my groups, you can join. The links will be in the description below. Okay, apocrine glands are present in, this was the question, apocrine glands are present in apocrine glands. So this is a very straightforward question. The answer here is going to be axilla. The answer here is going to be axilla. Okay, so this was discussed in the Cerebellum Academy. You can see here in the form of differentiation between eccrine and apocrine glands, and you can see that apocrine glands has A alphabet in it, and A for axilla, A for areola, A for apocrine glands open along the hair follicles, and apocrine glands are innervated by adrenergic sympathetic system. And apart from this, this site, that is groin, is the additional point which you need to remember. Rest of the others you can remember with this alphabet A. Okay, so please do hit that like button if you feel this kind of mnemonics are the great stuff with the help of which you can remember these points related to the glands or diseases. Okay, and this is the next question. So in this question, some students are telling that the question pattern was a little bit different. So this was actually INICET May 2023 exam repeat question. A young male aged 24 presented with mildly pruritic scaly lesions, symmetrically distribution. So the distribution is symmetrical and it was mildly pruritic lesion. So you need to identify and find out which option is depicting this particular case scenario promptly. So here you are able to see a annular patch is present, an annular patch, and you are able to see a scale which can be described as Collarette scale. And this kind of a patch which you see initially, there is a name for that, but before that let us see another diagram which was given. So this is having small lesions along the Langer's lines, and this is giving a appearance which is described as Christmas tree pattern, or fir tree pattern, and this is very classical in the case of Pityriasis rosea. We are going to see lesions which are going to follow this Christmas tree pattern. So one point which is towards the PR, the Pityriasis rosea, is Christmas tree pattern, and this annular patch which has a Collarette scale, it is called as mother patch, or it is also called as a herald patch. Okay, so let us look at the options. What is the first option? Says Collarette scale, Christmas tree pattern, and Pityriasis rosea. Okay, so this is going to be straight away the answer for this particular question. If you feel that this question body or the options are little bit different from what actually came in the exam, you can please feel free to put those changes which are asked in the actual exam in the comments below. Okay, so the option B says Wickham striae and lichen planus. Yes, in lichen planus we are going to see Wickham striae, which is a white lacy pattern, or network like pattern which we can see over the body. But that is not the actual image which is given, so this is not the answer. So option C is wrong. Christmas tree pattern is not seen in lichen planus. And option D says Voronov ring and seborrheic dermatitis. Remember, Voronov ring is a rim of hypopigmentation which we can see in the psoriasis lesions. Okay, so this Voronov ring is associated with psoriasis. Okay, so this is also not the answer here. And this is the topic which was discussed in the Cerebellum Academy app. So Pityriasis rosea and Collarette scales you can see here. And please remember, Pityriasis rosea is asymptomatic usually, yes, but there can be itching, mild itching can be present when we are going to use topical steroids for the purpose of the treatment. Okay, please remember this point. And all the points of Pityriasis rosea you can easily remember with the help of this picture which was also discussed in the app. So next is, this is the question which was asked: identify the causes that result in non-scarring alopecia from the following options. So this is a multiple correct type of a question which was asked. So you need to identify non-scarring alopecia. Please remember, this is again a INICET May 2023 exam, a repeat question. The answer here is, so first of all, we will find out what are the non-scarring alopecias. Alopecia areata is non-scarring alopecia. Telogen effluvium is a non-scarring. Androgenetic alopecia is also non-scarring. Frontal fibrosing alopecia is a scarring alopecia. So what are the options which are correct? 1, 2 and 3. So answer is going to be option B. Okay. Please do hit that like button if this question actually came in the real exam, and do comment if there are any changes which needs to be made in this question. So this was also discussed in the Cerebellum Academy app, and yeah, few points related to this. Please remember, non-scarring alopecia, apart from the alopecia areata, trichotillomania, tinea capitis, black dot and grey patch varieties, and secondary syphilis also are associated with non-scarring variety of alopecia. And of course, telogen effluvium is also an example of non-scarring alopecia. So this was the next question. A person presents with flaccid blisters and oral mucosal lesions as shown in the image, along with the histological finding shown. So if you look at the histological picture, what are you able to see? This is a histopath of skin. So the top layers which you are able to see, this is the epidermis, and the bottom layers which you are able to see are dermis. And you are able to see that in between the epidermis and the dermis, you are able to see at the rete region dermal papilla. So here you are able to see there is a split. Are you able to see this split? This is the split. And in this, you are also able to see that the stratum basal cells, which are the deepest layer of the cells in the epidermis, you are able to see that there is. So I will draw a picture here. So if you think that this is the rete ridge, oh, 1 second. If you think that this is the rete ridge, you are able to see that the cells are present in the rete ridge like this. Okay, these are the stratum basal cells which are attached to the underlying dermoepidermal junction, and they are separated from the rest of the stratum spinosum. So this is called as a suprabasal split, and this pattern is called as row of tombstone appearance. And if you look at the question, says flaccid blisters are present. Flaccid blisters, wherever you see, it simply means intraepidermal blistering disorder. Intraepidermal blistering disorder. And of course, oral mucosal lesions are given so that you can differentiate two intraepidermal blistering disorders, which is mentioned in the options. So option C and option D are straight away ruled out. Why? Because they are subepidermal blistering disorders. So we are left with Pemphigus vulgaris and foliaceous. So now tell me, Pemphigus vulgaris is going to be the answer. Why? Because in Pemphigus foliaceous, mucosa is completely spared. Foliaceous mucosa is spared. Okay, so the answer here is option A. So you are able to see there are mucosal erosions or ulcerations can be there. So this was also discussed in the Cerebellum Academy app. You can see row of tombstone appearance is classically seen in Pemphigus vulgaris. And these are all the features which was discussed even in this INICET marathon session. Okay. So this is the concept. Yeah, and this is the next question. Which type of image is shown here? So students told that yes, they got this as the image, and some students are telling this was the image. So please remember, in either of these images, what you are able to see, you are able to see there is a fluorescence. You are able to see there is a greenish fluorescence which is visible, and in this image, if we call it as A, you are able to see a linear greenish fluorescence is present along the basement membrane zone or dermoepidermal junction. So this is a bullous pemphigoid DIF finding. So the answer is going to be direct immunofluorescence here, DIF, direct immunofluorescence. And in this image you are able to see there is a granular pattern, granular immunofluorescence is present, and this is dermatitis herpetiformis, in which you are going to see IgA pattern of granular deposition of the antibodies and antigen complexes. So please remember the fishnet pattern. Fishnet pattern is very classically seen in the case of, so this was a topic which was discussed in the app also related to dermatitis herpetiformis, very important for you to remember. So this is bullous pemphigoid. You are able to see this linear pattern of IgG deposition along the basal membrane. So okay, so this is the next question. 60-year-old female male patient with diabetes presents with progressive skin lesions near medial canthus. So whenever you see a old individual that is an elderly person presenting with lesions over the face, the first thing which you should remember is malignancy. So with the help of this clue, you can rule out discoid lupus erythematosus and melasma. They are not malignancies. And if you look at the image, if you closely look at the image, you are able to see that the lesion is present in near the medial canthus, that is the first thing, the location site you are able to see. And if you look at the lesion, you are able to see that it is having this pearly white papules, and some pigmentation is also present, and these papules, they are present in an annular fashion. So if you see this kind of a lesion in elderly person, always think about the most common skin malignancy, which is basal cell carcinoma. Very important. It was even discussed in the app also, Cerebellum app. So you can see in basal cell carcinoma there is going to be this pearly white papule which is going to have telangiectasias on its surface. And if you happen to see a ulcerated BCC, then you can see rolled out margins. One more buzzword is rodent ulcer. This is the buzzword which you should remember for basal cell carcinoma. Okay, I hope these were the actual questions. If these were the actual questions, please do hit that like button so that I will get to know. If there is any discrepancy, please put in the comment section. Option were fish technique and flow cytometry. So Dr. Rajneesh, thank you so much for the addition of this point. So fish technique, so no, the immunofluorescence which I have shown you, it is not fish technique or it is not fishnet pattern. Fishnet pattern is seen in Pemphigus vulgaris. Fishnet pattern is seen in the case of Pemphigus vulgaris. So here is the image. So this is the Pemphigus vulgaris DIF finding, where you are able to see fishnet pattern. It is also not flow cytometry. So thank you so much for adding the option. So flow cytometry and fishnet technique. Okay, fishnet is already included. So yes, the answer is going to be direct immunofluorescence. There is no change in it. Thank you so much for adding the option. Okay, so this is the next question. Velvety pattern is present over the nape of the neck in a 13-year obese female. This is a very straight away image based question which you should be able to answer even if I wake you up from the deep sleep. Okay, this is Acanthosis nigricans, in which we are going to see the Acanthosis nigricans most commonly due to obesity. So Dr. Rajneesh, answer is direct immunofluorescence, just other two options were different. Okay, thank you so much for the clarification. Okay, yes, so this is most commonly associated with obesity. Not only that, remember in your OBG, you might have read this, guys. HAIRAN syndrome. How many of you read this or remember this? Please do hit that like button. HA stands for hyperandrogenism. IR stands for insulin resistance. IR stands for insulin resistance. And what does AN stand for? Of course, AN stands for Acanthosis nigricans. So in the case of polycystic ovarian disease, you might have heard this polycystic ovarian disease. Females, they are going to have this hyperandrogenism, insulin resistance will be there, and Acanthosis nigricans will be there. If you can recollect the rest of the options for this question related to Acanthosis nigricans, please put those in the chat section. Okay, if you can recollect, the students told that Cushing syndrome was there in the options. So this is Acanthosis nigricans discussed in the Cerebellum app. So you can see there is going to be a velvety plaque which can be present over the nape of the neck, axilla, and also even in the groin. And obesity is the most common association with Acanthosis nigricans. This is also a paraneoplastic condition. Why? If there are velvety patches present over the hands or mucosa, you should always suspect a possibility of a malignancy, which is gastrointestinal adenocarcinoma. Okay, gastrointestinal adenocarcinoma. This is also important for you to remember. Okay, and white patch present over the tongue. Okay, students told that this was the description which was given in the question. Some students told that there was a image given. So please put in the comment section if there was image, and like if there was no image. Okay, like this video if there was no image. And white patch present over the tongue which is not scrapable. This NOT not is going to be very crucial, which will change the answer from EBV to Candida. Okay, please remember, in Epstein-Barr virus we are going to see OHL, which stands for oral hairy leukoplakia, whereas in candidal infections, candidiasis, which is produced by Candida, there is going to be white patch present in the mucosa. But the difference between both of them is that in the case of oral hairy leukoplakia, there is going to be a white corrugated plaque present at the lateral border of the tongue, and this is non-removable or non-scrapable. Whereas in the case of the candidiasis, please remember, it is scrapable. That means if you are examining the patient of candidiasis, wear a glove, take a gauze piece. With the help of gauze piece, try to remove, if it is present over the tongue, try to remove the white patch or white plaque which is present. With the gauze piece, that white plaques will come out. That is, it is easily scrapable. Okay, whereas in the case of Epstein-Barr virus, so here the answer is EBV. This is how the presentation will be. So at the lateral border of the tongue, you are going to see a white corrugated plaque. White corrugated means feathery. What does corrugated mean? Feathery. So a white corrugated plaque will be present, and it is not going to be easily scraped or rubbed. Okay, this is the most important thing which you should remember. So thank you, Dr. Rajneesh. There was no image. Okay, no, there was no image, just it was mentioned that white patch is present which is not scrapable. So the not is going to change the answer from Candida to Epstein-Barr virus. If it was given scrapable, the answer would have been Candida. Some students might have answered it as Candida. So sorry students, the answer is EBV, Epstein-Barr virus, which is associated with oral hairy leukoplakia, and this is commonly associated with individuals who are immunocompromised, that is HIV. And what is the treatment here? The treatment is going to be highly active antiretroviral therapy. So hard treatment, if you start, this plaque is going to disappear. Okay. So these were the dermatology questions. If you have anything to add to this, or if you feel that there is any discrepancy, please leave it in the comment section. If this